Hello and welcome to session 8 of Doubting Climate Change, the role of public relations and media in creating doubt about the science behind climate change. What we're going to be looking at in this session is the notion of vaccination, immunization, and the doubts surrounding that. And this is as a case study that will be examining various aspects as we did with the previous case study we looked at in regards of smoking. So a brief overview of the history of vaccines, vaccine development. This is from Public Health England in the UK, and it's a timeline from 1796 up till 2015, 2016 on the major landmarks in the development of vaccination. And you'll notice there's a red ring around one in 1988 around the MMR vaccine. And this is particularly relevant for one of the issues we'll be talking about later in the session. So as vaccines have been around for over 230 years, there's obviously been some anxieties around them, particularly around in the early days when medical science wasn't as developed as it is now. So I've just put here a couple of examples you can see of historical advertising against vaccination, which is largely should have been dispelled now with the acceptance of modern scientific methods, etc. So here, this is just a slide that kind of covers the development, research development cycle for vaccines in terms of how long they take to develop and through all of the initial stages right until they reach the market. So it can go somewhere between maybe 5 and 18 years in terms of the development cycle that vaccines go through. And at every stage in the process, there are checks, there are trials, etc., etc. So it's a fairly well-established development cycle. Interestingly enough, when I first started working on this series a while ago, so back in 2019, I'll just skip the slide here. Back in 2019, this was the World Health Organization's 10 threats to global health. And I kept screenshots of these things. And one of the major issues that the World Health Organization was looking at in 2019 was the notion of an influenza pandemic. And they were tracking, so this is in October 2019, they were tracking the rise of the seasonal influenza virus and tracking it to see what they could do about it, trying to vaccinate people, etc. So this was immediately pre-COVID. And it's kind of interesting and ironic that I started to look at this in the months before COVID struck. So as a parallel to looking at that, this is a slide that shows the global spread of the Spanish flu back in 1918, which was the last major influenza pandemic that the world encountered. And back in 1918, it's kind of interesting to look at the global mortality rate was between 10 and 20%, which is quite high, which means that if you caught influenza back then, you had a 10 or 20% chance of dying, somewhere between those two figures. As the population infection rate was around 30%, this meant that between 3 and 6% of the global population died. Back in 1918, particularly post the First World War, record keeping was fairly sketchy, so it's difficult to arrive at an exact figure. But we can estimate that somewhere between 25 million and 100 million people died back in the Spanish flu pandemic, which obviously this was pre-vaccines. So it was a good comparison point maybe to looking at the role of vaccines and the efficacy of vaccines. Immunization, what does that mean? It means injecting people with a vaccine to try to prevent people catching the disease. And immunization is seen by the World Health Organization, by most medical practitioners around the world, as being one of medicine's greatest success stories over the last 200 or so years. It controls infectious diseases, it can prevent some cancers and other chronic conditions that are very debilitating and have serious social and economic impacts on people around the world. By removing disease amongst younger populations, it allows gains in education and economic development to take place in the societies in which these people exist. Immunization is successful, it's very cost effective as a public health intervention, and the World Health Organization suggests that if vaccination programs can be extended throughout the world, more than 1.5 million youth deaths, child deaths annually could be prevented. So a very effective, very cost-effective program, if you will. So moving on to 2019, this is a slide showing the outbreak of COVID-19 in Wuhan. So on the 3rd of January 2020, there were like 44 cases. By the 13th of April, there were nearly 2 million cases that were recorded. So it spread very, very quickly, very, very rapidly. And governments around the world didn't know quite what to do with this. And there was not really a unified global effort to deal with this. Some countries banded together, others tried to do their own thing. And it's kind of interesting in the way that different societies responded to this. And this is important in terms of understanding the doubt and anxieties that exist around vaccination and the way that they're developed and the impact that that has and the reasons why some people in organizations and some people of political persuasions try to create doubt around the efficacy of vaccines and try to portray them as something that's unnatural and that can actually cause more damage than they prevent. So kind of interesting, and within 12 months of COVID appearing in the wild, so to speak, there was a vaccine developed using radically new technologies, etc., that was quite successful to some people's minds. So this is a slide that just shows the process by which the RNA vaccine was developed and the process it took, the various stages it went through. And when we're looking at something like this, and this is what the vaccine deniers and the anti-vaxxers kind of forget, is that at every stage going through this process, the people testing the vaccine have to go through research ethics boards, which are there to make sure that the research is done in a very ethical manner, that it doesn't put people's lives at danger, and that any risks that are undertaken during the process are mitigated by good science and by good medical practice. So every single stage of the development of the vaccine has to go through research ethics. And this is a paper that was published in 2023, I think, and it was an estimate of how many people's lives were saved by the development of COVID-19 vaccine at that point. And the estimate was that over 14.4 million people around the world had survived because of the vaccine. And I know that there is evidence that shows that some people reacted badly to the vaccine, and unfortunately that's true of any medication that's available in the marketplace. Some people are going to react badly to it, and there's an inevitability about that. But as looking at it statistically, those numbers are very, very small in comparison to the numbers of people whose lives were saved. So then looking at vaccine hesitancy, and with any vaccine in any society at any time and around any medication, you have some hesitancy around that. So you can look at a population and you can say that there's high demand for vaccines by people who will accept all vaccines. They trust the medical science, they trust the government in putting these things into place and making sure that these things are as safe as possible. And so there's a high level of trust by a certain percentage of a population where they'll accept any vaccine. Then there are people who accept that the vaccine is going to be good for them or for their children, and that the government isn't trying to harm them or whatever, and that big pharmaceutical industries are not trying to kill people or to monitor them in some strange way. But they have some anxiety about this, whether it's needle anxiety, whether it's anxiety about is their child, or are they going to be one of the very, very small percentage of people in society who are going to be damaged by the vaccine and have an adverse reaction to it. And then you have people who will accept the vaccine, but they will delay to some extent in seeing this to make sure that other people who have got it, they don't die from it, etc., etc. So there's some hesitancy there. Some people will refuse to have it, either on ideological grounds or because they just they feel that their natural immune system is sufficient not to need a vaccine. And the demand for vaccines by people in this part of the model, the demand is much lower than it is by the people who accept all the vaccines. And then there are people who outright refuse to have vaccines, and these people who maybe rely on things, alternative medicine or traditional medicines, etc. and it's a very small percentage of the population. And then right at the far end of that, you get the people who are anti-vaccines because they don't trust the science, they don't trust government, they don't trust the pharmaceutical companies. And we saw a lot of that in COVID, where people were coming up with all sorts of nonsensical claims about what was in vaccines. People were putting microchips in them, et cetera, complete ludicrous nonsense, but they were creating doubt in other people's minds because of the loudness of their voices, and partly because of the way that the media represented this. And remember, we're looking at the media representation and how that can create doubt. And so we saw vaccine deniers, anti-vaxxers, being given quite a lot of prominence in traditional media. But the way of conspiracy theories, the way of these things on social media acts very differently to the way it does in traditional media. And the algorithms that are behind Facebook, behind Twitter at the time, behind Instagram, all of these social media platforms, they are looking for posts that create controversy. And then the algorithms will repost those and they will push these to other people. So far more than the science and the evidence, the science-based evidence behind vaccines. So you get a very disproportionate argument happening in the social media sphere and to some extent in the traditional media. So when you look at a model like this, you can see that anti-vaxxers, it's a very, very small percentage of the population. It's a very small voice. But in media, it's given a much larger voice. So it seems that there are more people who have doubt about vaccines than they actually do. And that can influence the people who are in the accept but some anxiety stage of the model. So it's important to bear that in mind, particularly, again, we're looking at this as a case study, looking and thinking about how climate change is being impacted by doubt. And so this is a model just to illustrate those notions of the role of traditional media and of social media platforms in promoting negative stories, in promoting controversial stories, and in promoting things that are basically denying basic science. So on the next slide, there's you can find this on the internet. There's a lot of websites that will look at the history of anti-vax movements. There's a lot of evidence-based science published in scientific journals, etc., which you can go and read and look at the history of the development of anti-vax movements. But I'm just putting a snapshot in here just to try to give an overview, a taste of how this works. And one of the prime things I want to talk about today is looking at this guy here, Andrew Wakefield, and his controversial paper that was talking about the MMR vaccine. And if you remember from the first slide in the history of the development of vaccines, I highlighted the 1998 development of the MMR vaccine. And what that was taking three separate vaccines that are well established since the 1950s, 1960s around measles, mumps, and rubella. And it combined those three vaccines into one shot. Because when you have a small child and they have to get they should get immunized, small children don't like being injected, so they cry, they scream, and it creates a negative situation for a lot of people. So the idea is if you can combine three vaccines into one vaccine, then children only have to have one shot. It reduces their trauma, it reduces the trauma of parents, etc., etc. And it was very well tested before it was allowed to be put in the public sphere, 1988. And so it was being used quite happily by a lot of people around the world without any real consequences. And this guy, Andrew Wakefield, who was a British research doctor, a medical doctor, and he did some research that was published in one of the most influential academic journals in medicine in the world, which is the Lancet, based out of the UK. Now you have to understand, when papers get published in journals, they're supposed to go through a blind review process. So the paper gets sent out to other scientists who work in that field. They look at the methods, they look at the data, they look at the analysis, and they say, this is probably okay for publication because it's probably replicable, it's probably reproducible, it's done by people who are accredited scientists in their field, etc., etc. And so the paper got published, and you'll notice it's up in the top corner, it says it's an early report. So this meant that it was fast-tracked into publication. because the scientists reviewing it thought it was kind of interesting. But it also meant that because it was fast-tracked, that maybe the rigor of the peer review process hadn't been as great as it could have been. And so this was picked up. Andrew Wakefield became a media celebrity, if you will. And what his paper basically was saying was that the combination of these three vaccines being given to somebody at one point created a situation where autism would arise in that child. And because parents don't want their children to be afflicted by anything, they want their children to be perfect, then anything in the public sphere that suggests that doing something to them, that you're trying to help them, actually causes harm, caused great alarm. The mainstream media picked up on this story, and it got a lot of traction, a real lot of traction over many years. And basically, Andrew Wakefield was given a lot of media exposure. He wasn't challenged particularly by traditional scientists who'd gone away to try to reproduce what he had done. And it took quite a long time for the medical world to catch up with the celebrity media storm that was happening around this. And this was pre-social media. So I can only imagine if this was happening now, the visibility that this story would have would be far greater than it did even back then. But this was a major story. And basically 12 years later, The Lancet retracted the paper. The people working with Andrew Wakefield walked away from the science because basically, and I just put here that it was retracted 12 years, but the damage that it had done in society generally around the world was incalculable. There was a big investigation into how this happened, and the scientists doing the investigation realized that they couldn't reproduce his results, and they tried to understand why they couldn't reproduce his results. And they realized that the 12 subjects that he'd done the analysis of were people that he'd paid. They were children that he'd paid. They were his friends' children, or they were friends of his kids. And he'd done the research at a birthday party for one of his kids. There was so many wrong things about the way that the research, it wasn't even real research, but the way the research had been done. And so it was basically withdrawn or retracted from the Lancet. Anybody involved with the science other than Andrew Wakefield walked away from it and said that they didn't want anything to do with it. He was tried by the medical industry. They took his practitioner license away so he could no longer practice medicine in the UK. And the work was established to be an elaborate fraud. He'd fraudulently set out to try to create a situation where he would get media coverage, where he'd get funding for his laboratory, based on a fraud, based on a lie. And he subsequently moved to the US, where he became a bit of a minor celebrity amongst a certain type of person who wanted to believe that this science was true. And he manages to nowadays, in 2024, he has quite a successful career in the United States on public speaking, where he's speaking to people who are basically anti-vaxxers and continues this movement. Damage was really quite profound. In 1998, at the same time that this was happening, there was a greener vaccine movement in the US, largely, because there was an ingredient used in the preservation of vaccines called thimerosal, which had at its core some mercury, very, very sort of minute amounts of mercury. Mercury is a poison, so people saw that this chemical was being used in the development of some vaccines, not very many, but some of the egg-based vaccines. And so they said this was potentially a real hazard for people being injected, immunized. And so there was legislation passed to reduce and remove thimerosal from vaccines. So today it doesn't exist in any vaccines today, and yet the anti-vaxxers continue to talk about this and scare people because in their discourse they say that these vaccines have this mercury-based poison inside them, and even though it's not true and it hasn't been for a long time. So in 2000, just as another milestone, in the US, there were no cases of measles at all because people were having the measles vaccine. So there were 0 cases in the United States. So out of a population of 340, 350 million people, fundamentally from a statistical point of view, so you could say the disease had been eliminated. In 2007, based on the work of Andrew Wakefield, and I use the word work in inverted commas, based on what he was doing, some people in the anti-vax movement in the United States, people on the fringes of medicine, people who were used to using alternative medicines, they started to pick up on this story. And then this actress, Jenny McCarthy, her son was diagnosed with autism, and so as a lot of parents did and do, they try to find a reason why their child has autism, because it couldn't just be random luck. There had to be a cause for it. And she became a figurehead for the anti-vaxxer movement, in particular around the notion of the MMR and other vaccines triggered the development of autism in her son. And again, because she was a high-profile celebrity in the media anyhow, she became, and she was very media savvy, she became a major spokesperson for the anti-vax movement. And she was in a relationship with Jim Carrey at the time, so the celebrity status around these people meant that the mainstream media gave them a lot of airspace and gave them a platform on which to talk about the anti-vax movement. Subsequently, there have been a lot of movies, a lot of books published by people with various backgrounds, medical backgrounds, scientific backgrounds, trying to promote the link between the MMR vaccine and other vaccines and autism, all of which have been disproven. There's so much evidence that shows there is absolutely no relationship between MMR vaccine and autism. It's been, if you do a search through WebMD, which is one of the databases where medical research gets published, you'll find there is so much evidence to prove that there is no causal relationship between the two. But the story goes on. So because of this work of celebrity anti-vaxxers, measles, people stop having their kids vaccinated, so now measles is returning. And measles is not a pleasant disease. Because we haven't seen it in our lives for a long time, we don't understand how horrible it is, but it's a fairly nasty disease to get, and it particularly affects kids. So in 2014, 159 cases, 2015, 186 cases. In 2024, cases again, and this is showing where these cases are arriving. And these are outbreaks where people need to be hospitalized or they die. So 283 cases in the US from a disease that had been completely eradicated. And as the anti-vax movement and as the doubt around vaccines continues, more and more people are choosing not to get their kids unvaccinated. So we see 90% of the people who had measles were unvaccinated. So, skip to 2017, some of our favorite faces, and we have here at Trump's inauguration ball in 2017. On one side of the photograph, you see Donald Trump with Andrew Wakefield. Andrew Wakefield was invited to President Trump's inauguration ball, which was kind of surprising, seeing as he was an outcast from the medical world. He's an outcast from British society because of the fraud that he perpetrated and because of the damage that has done to large swathes of populations around the world. And next to that, again, from a process at his inauguration, not exactly the same event, there's Donald Trump, Mike Pence, and Robert Kennedy Jr. And that's kind of interesting when we skip forward a few years. So these are some of the claims that Robert Kennedy has spoken about the safety of vaccine testing. And he's trying to create doubt around the efficacy of vaccines and around the safety of vaccines. He's claimed that vaccines are not tested for safety in clinical trials, which is absolute nonsense. He's claiming that no vaccines are subjected to placebo-controlled trials. Again, all of the evidence shows that he's basically lying in this or spreading a falsehood. It's the only medical product that is exempt for testing. He said this on the Joe Rogan podcast earlier this year. And you look at why is that important? Well, the influence, the reach that Joe Rogan has, whether one likes it or not, one has to recognize that Joe Rogan is one of the most influential voices speaking to young people in the United States at the moment. I think his podcast has somewhere in the region of 40 million followers. So this is getting a message out to 40 million people who are not getting their news from anywhere else. He's spreading doubt about the efficacy of vaccines amongst the generation of people who are going to be having families. So it's really kind of an interesting process to consider, to contemplate. So the truth of the matter is all vaccines undergo extremely rigid and rigorous testing to make sure that they're safe prior to their going to market. So talking here in 2024, the end of 2024, Trump, as a proxy for Kennedy, was talking about the statistics around the rise, the incidence of autism in the population. So he said in 2000 it was 1 person in 100,000 had autism, and in 2020 it was 1 in 100. And so he's trying to use these statistics to show that there's an issue around the incidence of autism in society, and by proxy he's talking about vaccines. CDC, Center for Disease Control, issued their own statistics. So in 2000, it was 1 in 150 people in the population were diagnosed with some type of autism on the spectrum, and in 2020 it was 1 in 36 people. Now you can look and say, well, there's obviously something going on here. It's around the vaccines, it's around something else. But the truth is, when you look at the way that society recognizes what autism is, rather than one single thing, it's a range of things that operate on a continuum. So there are more health options, there's better ways of diagnosing. So all of these factors need to be considered in understanding why the incidence of autism is being recognized more in society. It's not down to one single factor. And any scientist doing any kind of research will tell you that there are multiple factors that can impact something. And they all have to be examined before you can have any definite notion of causation. So in December 2021, Kennedy called the COVID-19 vaccine the deadliest vaccine ever made, saying that numbers of people that were dying from being given the vaccine were large, etc., etc. The truth is, go back to a slide I used earlier, COVID vaccinations in 2023 had been demonstrated to save an estimated 14.4 million people from dying. So the complete opposite of what Robert Kennedy's talking about. So come forward, December 2024, Robert Kennedy has been appointed to be in charge of health in the United States in Donald Trump's new cabinet. Why is this problematic? Well, we can see that both Kennedy and Trump are spreading disinformation, misinformation around the role of vaccines in society, as well as other health-related issues. And these are 7 of the things. New York Times last week published an article that looked at the 7 biggest lies that Robert Kennedy's been talking about. He talks about gender dysphoria and chemical exposure. He's been making links about that. He's been talking about HIV causing AIDS. He's saying it's something else that causes it. So again, completely flying in the face of what science is. When the COVID came along, he said that it was a disease that had been engineered in the laboratory, and it spared Jews and Chinese people, et cetera, et cetera. All of these kind of very strange pronouncements that he's made in the recent past. He claims a worm ate part of his brain. One of the most interesting things he said last week is that he used heroin while he was at college, and that heroin use made him a better student. There is a context in which he said that, which isn't seen here, but again, these are kind of very dangerous things that somebody in a position of such authority is saying. And there's a lot of concern amongst the medical community from this headline here, how measles, whooping cough and worse diseases could roll back into the United States under RFK Jr.'s watch. So by creating doubt in empirical evidence-based science and generating fear in a population, by spreading misinformation, disinformation and malinformation, it seems like the conspiracy theorists have become the government in the United States moving forward. And we have to understand why this is, why these people are spreading doubt and misinformation around so many things. Climate change, as we'll look at in the future session, but today around vaccination. And it's to do with this notion of an ideological approach to society. The right-wing Republicans want to take away regulation. Medical industry is quite highly regulated. The people who run medical industries would like it less regulated because they'll make more money. People on the left side of the political aisle want it to be more regulated to increase safety, etc. So there's an ideological war going on around this notion of regulation in the United States, and vaccines are one of the playing fields where this war between ideologies is going on. So when we're looking at this notion of doubt around how discourse is presented in the public sphere, we have to bear in mind what's going on in the background and why these things are happening in front of us. So I hope that you've enjoyed this little walkthrough, this case study around vaccines. It's been a little bit longer than usual, but there was a lot of ground to cover. So I look forward to seeing you next time.